Good evening. You're on the smoking section tonight, and I'm very happy to have Ken Thomas on tonight with me.
Thank you for having me, Steve.
Welcome.
Okay.
The last time Ken was on the show, we talked about misandry, and tonight we're going to talk about tobacco. And Ken has said that he would be willing to come back in and continue the talk about misandry again because we're living in very interesting times in that regard.
I would agree with that.
I would say it's almost the war, let's say that war revolved around misandry is almost as hot as the war on smokers.
I suspect so. Christina Hoff Sommers has written a book, The War Against Boys, How Misguided Feminism is Harming Our Young Men, to chronicle how there's a war on boys. I think it's also on men as well.
Have you heard about the book called Saving the Males?
I have not.
Well, remember that title because I heard someone on the air, another female on the air, talking about that, which was good, in my opinion. But again, today we're going to talk about tobacco, and we're talking about something rather specific that you brought up, and I thought it was very interesting. You were talking. Could you tell me what you brought up to me today? In the library,
that there was some research out about the radioactive effects of tobacco on lungs and on smokers.
Okay, and a particular radioactive, I think they call it an isotope, was mentioned.
There are several of them, and I mean it's pretty complicated. This article here is done by the which one is this? This one is done by a Greek research institute. The other one is done by the Indian Journal of Pure and Applied Physics.
And what year was the Indian Journal of Pure and Applied Physics? What year was that article?
That's 2010.
Mm-hmm. Mm-hmm.
And the Greek one is 2009.
But you also mentioned one where somebody said that smokers' lungs were the most radioactive place on Earth or something like that.
So I had been looking around on YouTube, being entertained by the things that were on YouTube, and there was a YouTube site that said what are the most radioactive places on Earth.
Yes.
And so we had this person for 8 or 11 minutes offering their viewpoints on what are the most radioactive places on Earth. And so they talk about Chernobyl and various places, and bananas, from bananas to Chernobyl to various places, to
yes,
flying at altitude, to the experience of astronauts who don't get the filter of the atmosphere to prevent them from exposure to radiation, to finally saying the most radioactive places on Earth are the lungs of smokers.
That sounds very. I have never seen anything. I've heard of this idea or this belief that smokers and tobacco smoke has this radioactive isotope, a couple of them. Let's just say, I think it's called polonium.
Yes.
210.
Yes.
And this has been kicking around for a while, but I've never heard anybody say that. I mean, that sounds rather hyperbolic. That, let's say, for example, my lungs are so filled with polonium that I'm kind of a walking time bomb, and that, I mean, if my lungs are the most radioactive place on Earth, that anybody near me is going to be exposed to potentially dangerous levels of. I mean, for example, you're sitting very close to me, and would you rather sit close to me, or would you rather go to Chernobyl and let's say.
Considering that you're walking and talking and breathing, I feel more comfortable sitting next to you.
Well, thank you.
You're welcome.
So would you agree with me that on first blush, that sounds like it could be a little hyperbolic?
Yes.
Oh, boy, we agree on something. That's
yes,
great.
We agree on
regarding
that.
Tobacco. Well, I did a little research on it. I don't prepare for this show very well, and that's one of the reasons I'm very happy that you could come on at the last minute.
You're more than welcome. I'm happy to be here.
To help me fill this time with what I hope is scintillating, or at least not altogether tiresome conversation for our viewers. Now, this polonium business has been around a long time in terms of smoking, and I did look up on the to see what the CDC said, which is the Centers for Disease Control and Prevention, and they are considered a very, very authoritative source. Although I would postulate that a lot of the statistics and data that they disseminate are designed to influence public opinion.
I suspect that may be true.
And they did mention that, for example, plutonium 210 and lead 210 are found naturally in the soil and air.
Mm-hmm.
So these particular isotopes, or let's just say polonium 210, is not something that's found only in tobacco smoke and only
Yes.
in the lungs of smokers. So if it's found naturally in the soil and in the air, presumably we all have a certain amount in us.
That would be likely.
Now, what was the final analysis of these papers you read? I mean, how extreme did they go in their, let's say, reporting of this new danger associated with tobacco?
I don't think they say that it's new. In the introduction, it says naturally occurring primordial radionuclides of uranium, radium series such as lead, plutonium,
Polonium, not plutonium.
polonium,
It's very hard to get that straight.
have long been associated with tobacco plants. Stated that the principal mechanism of incorporation involves root uptake from soil and phosphate fertilizers. And they quote someone who did that research, that the disposition of lead by rainfall is a principal mechanism of PB lead entry into plants. And they go on and on. I didn't read this.
No, it looks pretty dense, but I mean,
Yeah.
this is a this is a tactic that I would submit is used by anti-smoking forces a lot. For example, they say something like, "Did you realize that tobacco smoke contains 4,000 to 7,000 chemicals?" They like to use that.
That's not what this is saying.
Well, no, but that is said by. I'm kind of drawing an analogy. What they don't tell you is that studies have been done on just plain breath exhalation.
Yes, but that's not analogous to this. That's not at all analogous to either of these things.
Well, I'm saying that your breath contains about 3,500 chemicals,
Okay,
just when you breathe out.
okay,
So when they start using the word polonium,
yes.
it makes people frightened.
So we were talking a little bit before we came here on air.
Yes.
About why we didn't talk more about this in the library.
Today, you mean?
Yes,
Or
today or 5 months ago or a
tobacco
year ago.
issues, you mean?
And particular about the details.
The detail, yes.
The details about whether this research is credible. Does it come from credible sources or not? Because we have access to computers to the library, have access to librarians to help us do research, have access to books, and so we can go over these words, their pronunciation properly, and find out whether we're being stumped by words that are just difficult to pronounce or difficult mathematics and things like that. We could spend some time familiarizing ourselves with this stuff.
Right. Well, I mean, I think I have been doing that for a long period of time.
I don't think you have.
No?
No, I think that you didn't. From our conversations, I don't believe that you didn't address the Indian Journal of Pure and Applied Physics,
Okay.
for instance,
Yes.
and all the names.
Did I? Well, no, I can't. Okay. All right. But what I can address is that there is a tendency on the part of the research profession to demonize tobacco. In almost any way they can. There's a lot of funding, there's a lot of a chance to get publicity, etc., etc. So much of what is said, even by what might appear to be very bona fide researchers, people who have PhDs and medical degrees and work in public health, I think sometimes, or often, particularly when it comes to tobacco, is impeachable.
So why not leave there and just go right to physicists, licensed, educated physicists?
I don't think they're immune from this kind of research. Often is funded, or often has a point to, let's say, further a cause, even if they are a physicist.
I could agree. So that begs another question. Instead of talking about tobacco,
Yes,
we can talk about truth.
the truth.
How we ascertain what's true.
That's a
what's
difficult
credible,
question. That's a very difficult question.
What's meritocratic in the public realm of ascertaining what's true. And so instead of talking about tobacco, that seems like where we're headed. Like, how do we ascertain what's true in the public sphere?
Well, let me go back a little, and I think that's a very good question. Let's address that, but let's put that on the aside for a second. That
Fine.
very large philosophical question.
Good enough.
But this is a letter written regarding this polonium issue, and it was written by someone who is, I believe, a medical doctor from India, and is very very. I think it indicates a certain amount of, let's say, emotionality on the part of the doctor. And we normally associate doctors with science, but he goes, Dr. Shaw, Mitchell, and Dorling attempt to provide a simple but frightening statistic to convince smokers to kick the antisocial habit and throw the cancer stick to the nearest dustbin. In 1987, I wrote an article titled Radioactivity in Tobacco. Since anything radioactive gets top billing in the press, the item was picked up by a national news agency. Extensive coverage in dailies, newspapers, must hopefully dissuade a few people from smoking. This is something that is interesting. As soon as you use the word radioactivity, you are going to get a lot of press if you associate it with something that people come in contact with.
Yes.
And
it's invisible, or it's invisible, it's considered dangerous, carcinogenic, and
it
such
scares
and such.
people.
Yes.
But a lot of times radioactivity is, we're all exposed to radioactivity every day.
Yes, we are.
And just as we are all exposed to polonium and, let's just say polonium from the food and the soil. So when they say, for example, oh, it's in cigarettes, that frightens people. That another tactic, what I would call a scare tactic, to stop people from smoking.
Of course it is. I would agree with that. But I wouldn't have a tendency to look there. I'd have a tendency to look at epidemiological studies that are large over several countries and see what they say about smokers and non-smokers, how well the statistics were done on examining these different groups of people. That's what I would do.
But when you examine large groups of people, there's all kinds of difficulty gathering correct statistics. And I'll give you the big problem with epidemiology is, if you simply compare smokers with non-smokers, are smokers the same kind of people as non-smokers? So, for example, I would say that most smokers tend to be lower income. Most smokers tend to be more risk-taking. A lot of people who, let's say, are nervous and will find smoking very pleasant. I think a lot of people who smoke also drink a lot of, perhaps too much alcohol. So if you compare them in an epidemiological study with non-smokers, how bona fide, what conclusions you can draw that are accurate is a difficulty.
Well, that also begs another question about the reliability of statistics
Huh.
and statistical methods. So then again, we go, instead of, when we take that straight on, like, how reliable are statistical methods?
Well, some people say that you should never trust any statistics that you don't rig yourself.
And so then, who says that?
Well, I was told that particular quote by someone who was taking a course in statistics, and his professor said that.
So then I think it's important to poll a few professors of physics. I mean, not of physics, of statistics. Poll a few professors of statistics and find out why, do they agree on that, and why
Yeah.
they agree on that.
Right. Well, I mean, everyone has known that you can really manipulate the truth or hide the truth with statistics.
And so then one can look at precisely how that is done, and how statistics are used in a way that precisely and accurately reveals the way nature works, or attempts to model natural phenomena.
Do you have any examples of statistics that you've used that seem to indicate something that you take as reasonably accurate?
I observed being used cell phones.
Yes, right. There are a lot of them being used. Yes.
I recently bought my first one a couple months ago.
Mm-hmm.
I don't use it, but when I have used it once or twice, it enabled me to talk to someone who was very distant from me. So there were some statistical methods that were used to understand how signals, electronic signals, how voices are turned into electronic signals,
Yes.
and being sent other places. To me, that seems pretty reliable.
Right.
Seems to be a pretty good, a very efficacious use of statistics.
But but that, I don't think the invention of, let's say, I think Thomas Edison's invention of the telephone,
Yeah.
I don't think that was based on statistics.
I think though cell phones is more statistical, and at some level.
And what do you think, for example, about, well, here's an example that I think statistics, I think, are accurate. For example, it would appear to most people that cell phones while driving is probably a dangerous habit, right?
In the sense that people have attention that's limited.
Yes.
And when they're putting their attention on a cell phone while they're driving 60 miles an hour,
Right.
it can lead to some hazards.
But unfortunately, or fortunately, however you want to look at it, if you look at the accident statistics for automobiles over the last, let's say, 20 years, it's not as if accidents, let's say, have increased. We are not having more fatal automobile accidents have been constantly decreasing over the last 50 years, probably.
I have a tendency my hunch tells me it's just the opposite.
You think so?
Yes.
Oh, no. Ken, you can trust me on this.
I'm not going to trust
No, you're
you.
not going to trust
No,
me.
no.
But
we should go to the internet.
Oh, you can. No,
and
that's
we
not
should go
hard.
to somewhat
That's not hard to
reliable
find.
sources.
Oh,
and
fatal
find out-
accidents in automobiles have decreased over the last 30 years. Let's say.
Okay, I'll
That's a pretty...
without looking, I'll take your word for
And
it.
certainly since the advent of cell phones, it's not as if we're seeing all kinds of fender benders happening in Cambridge that we didn't see prior to the cell phones.
In actuality, I don't notice that to be the case either. I
Right.
don't.
Which kind of is funny because I would think with cell phones there would be huge numbers of accidents increasing.
And you say that that's not the case.
It does not appear to be the case, no, in
Okay.
terms of statistics. And,
Okay.
and in terms of my observation, I don't see I don't see that many accidents, knock on wood, in Cambridge.
And you're willing to trust those statistics to tell you that nationally there's been a decline in automotive fatalities.
Over the last 30 or 40 years.
You'd be willing to trust those
I
statistics?
tend to trust that, yes. I tend to
Okay.
trust that. Now, why do I tend to trust that and not trust...
Yes.
Well, let me give you an example of a statistic that is really misused, okay? And maybe I'll even be able to persuade you that you would agree with me. For example, it is said that 480,000 people die from cigarette smoking every year in the United States.
480,000?
That's correct.
Okay. That's what's said.
That is the official figure that's given out by all the authoritative bodies, scientific bodies like the Centers for Disease Control, National Institutes of Health, American Cancer Society, etc.
Okay.
Well, 30 years ago, when C. Everett Koop was the first, well, one of the very strong anti-smokers of the Surgeon General, 30 years ago, he said that 400,000 people died.
Mm-hmm.
Now, the smoking rate has gone down
Mm-hmm.
for 30 years.
Mm-hmm.
How can the number of people who are said to die from smoking go up?
It's a good question.
That seems to me like a statistics that's used more as a scare tactic. Would you, without doing any research, does that appear reasonable to you, that
It
it's
does.
a scare tactic?
It does.
And another thing that statistic does not say is, for example, that when you talk about deaths from smoking, if you believe everything they say about smoking,
But I don't believe everything
oh well,
they say.
I'm glad to hear that. I'm
You're
really
more
glad
than welcome.
You know,
I don't believe everything. That's
you
not the
believe
good
a lot.
I do.
Well, no, I think you do, because from our conversations in previous days. Ken, let's talk about, okay, and one thing that statistic also doesn't say is at what age people are dying from smoking-related illnesses, illnesses that are said to be caused by smoking or implied to be caused by smoking. And one thing about it is those people who are dying from illnesses said to be caused by smoking are dying in their 70s and 80s. Normally, 60s, 70s, and 80s, mostly 70s and 80s, or even 90s sometimes. But those, like other things like drug overdoses, automobile accidents, homicides, suicides, those are all often people in their 20s and 30s.
To be clear, I don't smoke.
Mm-hmm.
And I engage in some physical activities that I find very strenuous.
Yes.
So strenuous that I find myself cognitively, besides doing the physical activity that I am doing, trying to inhale air.
Yes.
And so I tend to find that, I don't find smoking at all to be advantageous to the physical activities that I'm doing.
But you've never tried it.
I haven't.
Oh, you did smoke at one time.
You said tried? Of course I've tried it.
Oh, you smoked.
I've tried it.
Yeah.
Sure. And I've also found that it tastes bad and it inhibits my ability to breathe well.
Did you ever smoke for a period of time? I mean, or did you just take a cigarette or two?
You seem to be prying with that.
Well, I'm asking questions. This is the smoking section.
But you don't seem to be wanting to get at the truth. So I noticed that when people are doing, athletes like
Mm-hmm.
marathoners and whatnot. I don't know this to be the case, but I'd like to poll some of the world's best athletes
Yes.
who do endurance exercises and find out which of them find that smoking enhances their physical performance.
It's a good question.
Sure.
Now, we are coming close to, we've only got 40 seconds left. So I think, Ken, if you wouldn't mind, I think we will save our next talk. We will start out with how does one determine what is true or not? Because that's a question you brought up and I put on the side.
Good enough.
And we will talk about misandry, particularly in our current world. And we have now about 10 seconds, and I want to really thank you for coming on the show.
You're very welcome.